This is the third video on fatty liver and will discuss diagnosis. Majority of patients with fatty liver are unaware they have this condition. They appear to be healthy and have no symptoms. One reason why they are diagnosed to have a fatty liver is that when they see a doctor for a medical checkup or some other medical problem, blood test for the liver is done. The blood test looks at two enzymes called liver enzymes. They are ALT or alanine transaminase and AST or aspartate transaminase. The doctor then notices that these liver enzymes are raised. There are many causes of a rise in these liver enzymes. One of these is fatty liver. The doctor usually proceeds to do a liver ultrasound, which is fairly accurate at detecting excess fat in the liver. I will discuss this later. A few patients may complain of symptoms which includes tiredness and some discomfort over the abdomen on the right side. There are many causes of these symptoms, including fatty liver. By the time obvious symptoms arise, many a time the fatty liver has progressed to the stage of liver cirrhosis. These obvious symptoms of liver cirrhosis are discussed in video 6. What investigations will a doctor do if he or she suspects fatty liver? They will first take some blood for a liver function test to look for elevations in the liver enzyme AST or ALT. Elevation in these liver enzymes indicate liver inflammation. Patients with simple fatty liver would have normal AST and ALT, while those with NASH will have a high AST and ALT. Next, the doctor would order an ultrasound of the abdomen. This is how an ultrasound machine looks like. If the patient has fatty liver, an ultrasound could show that the liver looks brighter than a normal liver. This will strongly suggest that the patient has a fatty liver. In fact, the accuracy of detecting fatty liver using an ultrasound is about 85 to 90%. Sometimes an ultrasound is done for some other indication during a routine medical checkup or for stomach pain, and not because the doctor suspects a fatty liver. The doctor might do a few other blood tests to rule out other causes of a high liver enzyme. These would be blood tests for viral hepatitis B and C. Blood tests will also be done for conditions associated with fatty liver like blood sugar, cholesterol, triglyceride, thyroid hormone, and insulin. Next, the doctor might order tests to look for how much fibrosis or scarring of the liver has taken place. This is important as management will depend on how much liver fibrosis is present. There are 4 such tests that are generally done. One is called a scan or transient elastography. An example of such a scan is the FibroScan. Liver scan or transient elastography. This scan looks similar to an ultrasound. However, it uses low-frequency sound waves to look at the degree of liver stiffness. Liver stiffness is a marker of fibrosis. The more the liver stiffness, the more the fibrosis. The second test to look for fibrosis is a blood test. This blood test calculates fibrosis by using a mathematical formula based on patient's age and biochemical profile. One such test is called the fibrotest. The third method to look for fibrosis is called magnetic resonance elastography or MRE. It uses a combination of magnetic resonance imaging and ultrasound to look for fibrosis, and it's a fairly accurate and non-invasive way for looking for fibrosis of the liver. The fourth and final test is the liver biopsy. Liver biopsy is the best method for determining liver fibrosis. It is a gold standard in diagnosing fibrosis and cirrhosis. Liver biopsy is also used to determine the severity of liver inflammation. The doctor will insert a thin needle through the skin and take out a small piece of liver tissue. A tiny piece of liver tissue, less than 1/50,000th of the liver, is taken and sent to the lab for analysis under a microscope. However, this test is not routinely done, as it can sometimes be associated with a rare but serious complication, namely bleeding. This can occur at the site where the needle enters the liver. The doctor will usually take all necessary precautions to ensure that the procedure is safe. Nowadays, the liver biopsy is done under ultrasound guidance, which further minimizes complications. In spite of all these precautions, bleeding can still happen. Fortunately, in most instances, the bleeding stops on its own and there is no need for surgical intervention. The patient should discuss the risks and benefits of the procedure with their doctor. However, today, the non-invasive methods of looking for fibrosis, like the fibroscan, blood tests like the fibro test, and the magnetic resonance elastography, have replaced liver biopsy in most instances.